Hello, and welcome to my presentation. This presentation will discuss a current and present economic need in our community that can and should be addressed by the Allegheny Health Network, or AHN. It will present a proposed intervention that the network can carry out to combat this issue and present the costs and benefits of doing so. The issue to be addressed in this presentation is that of uninsured patients. The United States is one of the richest and most developed countries in the world. However, approximately 30 million people in the United States do not have health insurance. Natrona Heights has a listing on the United States Census database of 26% of the population being below the poverty line, compared to 12% in the state of Pennsylvania. Since most people typically obtain health care coverage by paying for the benefit through their employers, even when these patients have steady jobs, they must use their limited finances for essentials like housing and food rather than health care coverage. In a 2016 study of uninsured patients, it was found that over 38% of patients had no primary health care visits in a year. Even more troubling, 19.6% of the sample also had a diagnosis of chronic disease. When chronic diseases go undiagnosed or untreated due to a lack of healthcare coverage, these patients develop complications that lead the trip to the emergency room. While EMTALA laws ensure these patients get emergency treatment, without active, ongoing treatment, they will only get worse, leading to further hospitalizations or death. This creates a severe strain on the resources of the staff of hospitals, as well as an increase on the burden of these patients' families. This is an issue that hit me close to home. My youngest sister, Kimberly, was unemployed for a time due to budget cuts and left without health insurance. When she developed leg pain that would not go away, she could not seek treatment because she could not afford the doctor bills for what seemed like a minor issue. When she again had insurance and went for treatment, she was found to have multiple clots in her leg from factor V Luden, requiring a hospital stay. We were told that her clots were so extensive it was a miracle she did not develop a life-threatening embolism. This smiling face might not be here today simply because she could not afford to get treatment for something she had no idea was a medical emergency. How could this happen in a wealthy, developed country like ours? Kimberly is much more than a smiling face. Along with being a community leader and a head lifeguard, my sister was an accomplished firefighter. Despite being recognized early in her career as Firefighter of the Year, she was temporarily unemployed because of budget cuts. This is a woman who has worked to save lives in house fires, braved wildfires all over the country, and even been dangled off of bridges to rescue people. All of the pictures you see here are of her. She was restored to her job and received health coverage, and with it life-saving treatment, just in time. How many lives would have been lost had she not been there doing her job, just because she could not afford to pay for a basic health screening? According to its website and mission statement, AHN exists to help everyone embrace health and live healthier lives. To accomplish this goal, it is essential that the network looks into ways to provide health care to the uninsured who cannot afford traditional provider or hospital visits. One option that has worked well to help those who lack health coverage is the creation of free clinics. As AHN already has a strong presence in the area, it will be relatively easy for the network to open clinics in and around Natrona Heights. These clinics can provide care at no or reduced cost to uninsured patients. Similar clinics have been used in other areas of Appalachia that are more rural than Natrona Heights. These have been successful at offering high-quality, affordable health care, including screenings, eye, and dental care. These clinics can help bridge the gap created by income disparity and be expanded to reach even more patients. By providing early diagnosis and treatment of disease, free clinics save money by reducing emergency admissions. This saves resources, reduces staff workload, and most importantly, saves lives. While providing free clinics would on the surface seem like a great expense, the truth is that these clinics can pay for themselves. Untreated chronic diseases lead to frequent emergency hospitalizations, creating drain on healthcare resources and staff as well as increased costs. Early detection and treatment at free clinics can reduce or eliminating this, offsetting the costs of these screenings. Many uninsured patients are unable to get assistance until they have already developed life-threatening complications. By providing free screenings, disease can be caught and treated early. Again, the benefits outweigh the cost, especially when the lifetime cost of trying to treat these complications is considered against the cost of early treatment and prevention. Treatment of complications includes financial, use of medical resources, and potential burnout from staff who frequently see the same patients repeatedly. Free clinics can provide the education and assistance to help patients learn to manage their own disease, resulting in decreased hospitalizations. In addition, free clinics can make the entire network more financially viable. By bringing health care to people where they live, the network increases the awareness of these areas of the services being offered throughout the network. Bringing quality, affordable health care to people with economically disadvantaged areas can also help reduce the negative stigma that residents of these areas frequently have based on past poor experiences, making them more likely to seek out care in the future. In a nutshell, When people trust the network, they will use it. Although people with limited financial means are often also thought of as having limited education and intelligence, these people are all too aware of the disparity present in the current state of the American healthcare system. The use of free clinics can help bridge that gap, allowing those without health insurance to have access to the same high-quality healthcare enjoyed by those who are insured. According to Lazar et al., areas of economic depression such as Natrona Heights are more vulnerable to health disparities compared to other areas. In order to help these people, it is necessary that the network works to bring healthcare to them. For example, the network can help diabetic patients by providing free screenings, including glucose testing and education about diet and exercise at community events such as fairs. These screening events can raise community awareness of the free clinics as well as the traditional services being offered, resulting in an increased revenue. When people become familiar with the network, this can increase the trust in the healthcare system that many low-income patients have been found to lack. Especially among patients who are not only of low income but also members of minority groups, creating good experiences with healthcare providers is essential in order to encourage these patients to seek out care. America is unusual among its peer countries because it does not provide citizens with universal basic health coverage. For those who cannot afford to pay for their own coverage, this frequently means that seeking out health care outside of an emergency is difficult or impossible. Unfortunately, by not seeking out regular health screenings, chronic or life-threatening illnesses go undiagnosed or untreated until they become an emergency. By providing free clinics in low-income areas, AHN can help care for these patients, reduce complications caused by chronic disease, increase its presence, and ultimately reach its goal of providing a healthier world. Here are my references. Thank you for listening to my presentation.